La medicina nucleare ha avuto negli ultimi decenni un enorme sviluppo. Essa rende possibile diagnosi e cura all'avanguardia per molte malattie importanti tra le più gravi e diffuse, come il cancro, le malattie cardiovascolari e le patologie del cervello. Per tale ragione, a nome della Commissione Salute, Industria e Ricerca del Parlamento Europeo, ho accolto con favore e ho inteso patrocinare l'iniziativa lanciata da AIPES, che ha come fine quello di portare a conoscenza delle istituzioni europee l'importanza della medicina nucleare, diventata nel corso degli anni interprete principale del nucleare buono, quale strumento essenziale per l'identificazione ed il trattamento di numerose patologie, specie quelle di natura oncologica. Negli ultimi anni la medicina nucleare si è diffusa capillarmente su tutto il territorio europeo, come strumento di diagnosi e cura, offrendo alla popolazione un contributo determinante per il miglioramento della durata e della qualità della vita. Le innovazioni nel settore hanno garantito un significativo avanzamento sia dei macchinari, come la PET-TC o risonanza magnetica, sia dei farmaci utilizzati che hanno aperto la prospettiva a nuove strategie terapeutiche mirate a colpire tante forme di neoplasia, dal tumore alla prostata ai tumori neuroendocrini. Per tale ragione occorre incentivare e stimolare ulteriormente ogni utile iniziativa che miri a sviluppare le attività di ricerca in materia di medicina nucleare. Negli ultimi 7 anni l'Unione Europea ha investito quasi 1,5 miliardi di euro in attività di ricerca nella lotta contro il cancro. Molto resta ancora da fare, se pensiamo che i recenti dati Eurostat attestano ogni anno e si stimano che nell'Unione Europea oltre 2,5 milioni di nuovi casi di cancro, con un costo annuale quantificabile in 126 miliardi di euro. Incentivare gli strumenti di diagnosi e prevenzione rappresenta pertanto una sfida significativa per le istituzioni europee e i singoli Stati membri devono raccogliere e vincere per il miglioramento delle condizioni di vita delle generazioni future. È per tale ragione che ho inteso supportare con convinto entusiasmo l'attività dell'AIPES, certo che attraverso i momenti di dibattito e di confronto che si svolgeranno durante il Symposium del 28 settembre prossimo, 21, si possa scrivere un'ulteriore importante pagina nell'evoluzione della medicina nucleare.
You know, Europe is today currently opening fantastic fields of development in nuclear medicine, particularly in cancer treatment. Nuclear medicine is bringing new opportunities, very many, in cancer treatment particularly, but in diagnosis and also in therapy. And Europe is today a leading continent in this development. We are very happy to see that many research centers, universities, industries are developing new drugs, new potentials in diagnosis and also in therapy in this field. And cancer treatment is a main focus for this industry, nuclear medicine. So as a president of AIPES, recently elected, you know, it was just a couple of months and I'm very flattered for that. I'm very happy to lead this groupment of interest of the industry in Europe. We are very convinced that Europe is basically leading the game now in development of new drugs and new development. And the Europe is really very effective in that field. Nuclear medicine is like a bowling, you know, environment where many new development research are currently happening in Europe, but also in the US and other continents like Asia. This is a very promising segment of medicine, providing many opportunities for healthcare, particularly in cancer treatment. So what's nuclear medicine all about? This is very special because it's bringing new opportunities in terms of targeted treatment of typical cancer, you know, targeting exclusively the cancer cells. And the purpose of that, the advantage of nuclear medicine is that we can avoid or diminish all the secondary effects that everybody knows. You know, all relatives having cancer with all the painful treatments. Nuclear medicine, I think, can bring opportunities in reducing these side effects, you know, like losing hairs and painful treatment and digestive problems. Nuclear medicine in the future will target specifically the cancer cell. And that's what we are really looking for. in the development.
Hello, my name is Roy Shepherd, and as the population continues to live longer, the costs of healthcare continue to rise in an economic environment where budgets are being cut in many, many sectors. And the subject of nuclear medicine has captured the interest of committees for health and industry here at the European Parliament, because the indications are that nuclear or molecular medicine, as it's sometimes called, can help save money whilst simultaneously improving diagnosis and provide more effective treatments for cancer. But what is nuclear medicine? Is it real, or is it something from Star Trek perhaps? Well, to find out, the European Parliament has invited these experts from the field of nuclear medicine to explain what it is, what it isn't. It's also got the word nuclear, so the question is it safe? And most importantly, how does it help the treatment for cancer patients? Well, we've been joined by Dr. Fred Verzelbergen, who's the former president of the European Association of Nuclear Medicine and is head of Department of Nuclear Medicine at Erasmus University Hospital in Rotterdam. We also have Antonis Kalemis, PhD, who's a medical physicist, and we've been joined by Dr. Ivan Forte, who's a representative of the European Parliament for the European Health and Industry Committees. Ivan, if I can start with you, why is the European Parliament interested in nuclear medicine, and why have you gone to the trouble to bring these experts together?
Well, actually, last year we had the pleasure to be invited from AIPES to the symposium that they hold in Brussels last October. And as a member of the European Parliament, member of the Health Committee and Research Committee, we understood that there are a lot of things that we don't know about research activities running nuclear medicine. So if we talk about citizens, we talk about patients. And since the European Parliament represents 500,000 citizens, we thought that it was necessary for us to invite experts and to have a closer cooperation with those kind of experts for this kind of symposium that will be held in September.
Fred, if I can ask you, is it safe?
It is, absolutely. And it's what the previous speaker said. We want to avoid to have the discussion about nuclear energy and nuclear medicine. It's completely separated. And don't speak about nuclear medicine when it's about energy.
All right, so how toxic are the nuclear pharmaceuticals that get injected into patients' bodies?
You have to separate diagnostic and therapeutic procedures, of course. Nuclear medicine for imaging, diagnostic procedures is very safe. No side effects afterwards. For therapy, sometimes you see small amounts of patients who suffer side effects, but these side effects are small.
So that's in comparison to people I know who've had chemotherapy, for example, which is a mainstream therapy for cancer, where the side effects are pretty horrendous, actually. So
absolutely.
You say that they're not the same at all?
No, and it's because nuclear medicine is targeted technique. We go to the source of the trouble, the disease, the cancer, and we avoid treating any other area in the body, and that makes it so safe. Nuclear medicine as a targeted way of diagnosing and treating patients without the toxicity of traditional medicine. And that's so important.
So can you give us the overview, the bigger picture? What would you say is nuclear medicine, and what do people get wrong about it?
So nuclear medicine is a way of medical imaging to actually visualize physiological processes in the human body, so how your body is functioning. And we do that by injecting specific radiopharmaceuticals or entities that are being taken up specifically, as Fred said, from cells or even specific cells in the body.
At a molecular level.
At a molecular level, exactly. And this provides an understanding of how your body is working when you see the images either in a dynamic or even static way.
So why has it really started to take off now and become much more widely known and more widely used? Because 60 years for a technology is a long time.
Mm-hmm. In my opinion, molecular imaging or nuclear medicine comes hand in hand with what we say personalized medicine. So that is the way that you understand the disease and treat the disease at a personal level rather than at a population level. And molecular imaging at this point in time is one of the very few tools that precision medicine or individualized medicine has to realize itself.
So Fred, what do you think the concept of personalized medicine is going to do to change the way that people are treated for things like cancer?
If you take the example of chemotherapy, we know that many patients are undertreated, overtreated, etc., with all the side effects. And personalized, or better, precision medicine is so promising because you can avoid all these extra side effects and go to the tumor, go only to the tumor and not to the rest of the body. The damage, the toxicity is much less. I will keep on saying that.
Antonis, what are the biggest frustrations that you have as experts in nuclear medicine?
It's probably the level of understanding of the public and the knowledge of the public about the applications and what is the level of safety that those applications imply or they have. I think this is the most important obstacle that we need to break through, and this is also the reason for the symposium that we are discussing today about to actually let people understand better what is nuclear medicine and how safe it is.
How prevalent do you think nuclear medicine will be in the treatment of not only cancers but other diseases in the future?
Well, actually, we have been talking about cardiovascular disease, cancer diseases, so we do think that with improvement of research, the use of nuclear medicine could be even better and even wider. So we do think that European Commission and European Parliament, apart from a legislative point of view, should start to invest even more in, for instance, in Horizon 2020 program, in all our funds concerning research and innovation to push the research even further.
So may I add to that, if I may? Of course, oncology and cardiology constitute something like 97% of the current nuclear medicine procedures, but we have to remember that nuclear medicine is also targeting, for example, the way that amyloid plaques exist in the brain with respect to Alzheimer's disease. And Alzheimer's disease is a huge burden, health burden in the European Union as well as globally. And there are recently new drugs in phase 2 and 3 trials that are coming out that target exactly the same targets, the amyloid plaques, that we already have tools in nuclear medicine to visualize them. So you can understand that this is something that it might be a great tool for these therapies in the near future.
My first frustration in this respect, coming back to your previous question, is that we develop a lot of new compounds, and they are very attractive. They are very personalized and precise. But these compounds are not registered for use in patients, and that is this my frustration. It takes a lot of time to go all the procedures and to be able to use them in a clinical situation.
But that's a good thing, though, isn't it? It's a safety thing.
It is safe, but these compounds are safe, and we should find ways to bring them to the clinical application much faster, and we need the EU with that. Find small trials to be able to make these compounds registered very fast.
I've heard some people say, well, actually nuclear medicine is more expensive because the technology is expensive. So where do the savings come from? There's a bit of confusion here, perhaps.
But you can say that in different ways. For instance, if a patient is treated with traditional anti-cancer treatment, this is very expensive, almost 80 to 100,000 euros a year. But we can, with nuclear medicine techniques, evaluate the effect of the first treatment and stop after 1 or 2 treatments instead of going on for a long period. So
to wait to see if it works, you mean?
Yeah, and otherwise make a change to a different kind of treatment. That is one way to save a lot of money, but there are many different ways.
What excites you the most? I mean, you're a researcher through and through, and you've spent decades researching nuclear medicine.
What excites me most is the current ability to go to any type of disease or tumor and target molecules on the membrane or inside the cell and image them and treat them. And that is because nuclear medicine is not as a basis in biochemistry, genetics, etc., etc. So a lot of developments come from these specialties, which enables us to target what we want to visualize and what we want to treat in the body of the patient, and again with less toxicity.
So is that the only real benefit to patients, would you say?
I think, yeah.